Hi everyone, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers. One of the most common conditions we see in our office, and one that causes a lot of confusion, pain, and sometimes even fear, is a herniated disc. Want to download our disc herniation guide? Click on the link below. Know you have a disc herniation and want help? Click on the second link below to book an appointment. If you've been told you have a disc problem, or if you've been struggling with back pain that just doesn't go away, this video is for you. By the end of today's video, you'll know what a disc herniation actually is and what it isn't, the most common symptoms of how people often mistake it for other conditions, why proper diagnosis matters, and how we can use a treatment called decompression to help patients find lasting relief. What is a disc herniation? Well, let's start with the basics. Between every bone in your spine, called vertebra, you have discs. Well, between almost every bone in your spine, the top two bones in your neck don't have a disc. There's a lot of interesting things that happen between these two bones in your skull. I'll probably do an entire video on upper cervical in the future. Anyway, back to herniations. Discs act like cushions or shock absorbers. They allow your spine to bend, twist, and move without grinding bone on bone. Each disc has two main parts, a soft gel-like center called the nucleus pulposus, a tough fibrous outer layer called the annulus fibrosus. A disc herniation when that soft inner material pushes through the weak spot or a tear in the outer layer. Think of it like squeezing a jelly donut. The jelly donut just bulges or leaks out. Here's the important part. Discs themselves don't actually hurt. Pain happens when that bulging material irritates nearby nerves, or in degenerating discs when new blood vessels and nerve fibers grow into places they don't belong, making the disc itself sensitive. Common symptoms of a herniated disc. So, how do you know if you might have a herniated disc? Here are the most common signs we see. Localized back pain, often in the lower back, sometimes in the neck. Radiating pain, sharp shooting or burning pain that travels down the leg or into the arm if it's a disc in the neck. Numbness or tingling in the legs, feet, arms, or hands. Muscle weakness, difficulty lifting the foot, known as foot drop, gripping objects or standing tall. Pain that changes with movement, worse when bending, twisting, or sitting for long periods. Some people describe it as a lightning bolt shooting down their leg, while others say their leg feels heavy or clumsy. Here's where it gets tricky. Herniated disc symptoms overlap with other conditions. That's where misdiagnosis can happen. Common misdiagnosis. A lot of patients come to me after months or even years of chasing the wrong diagnosis. Here are the most common mix-ups we see. Sciatica without identifying the cause. Sciatica is a symptom, not a diagnosis. It means the sciatic nerve is irritated, but the real question is why? Sometimes it's a herniated disc, sometimes it's spinal stenosis, sometimes muscle entrapment, sometimes it's not the sciatic nerve at all, but a hamstring or a piriformis issue. Peripheral neuropathy. Burning, tingling feet aren't always neuropathy. A lumbar disc herniation can mimic neuropathy symptoms. Hip or knee problems. Pain radiating down the leg is often mistaken for arthritis or joint problems when the real culprit is a disc pressing on a nerve root. Muscle strain. Back pain that lingers for weeks is often brushed off as a pulled muscle. But if the nerve is involved, it won't get better with just rest. That's why an accurate diagnosis matters so much. If you treat the wrong condition, you never really get better. How we diagnose disc herniations. In our office, we start with a detailed history and physical exam, including x-rays. We test muscle strength, reflexes, sensation, and movement patterns. If we suspect a disc problem, we may order imaging, an MRI, which can show the size and location of the herniation. But here's something important. Not every disc herniation causes symptoms. Studies show many people walk around with herniated discs and don't even know it. That's why it's critical to match the imaging with the clinical exam and not just rely on one or the other. Traditional treatment options. Before I explain how decompression helps, let's quickly review the traditional options most patients are offered. Rest and medication, often the first line, but it only masks pain, it doesn't fix the problem. Physical therapy, helpful for mobility and strength, but can be limited if the disc pressure isn't addressed. Epidural injections or epidural steroid injections can reduce inflammation, but usually temporary. Surgery, necessary in severe cases, but comes with risks, downtime, and no guarantee of long-term success. This is where patients often feel stuck. Either they keep living with the pain or roll the dice with surgery. The decompression solution. At our office, we use a non-surgical option called the Ergo-Flex Back on Track Decompression System. Here's how it works. You're positioned comfortably on the table and it gently stretches and releases the spine in cycles. This creates a negative pressure inside the disc, almost like a vacuum effect. That pressure can help draw the bulging or herniated material back inward, reducing nerve compression. It also improves blood flow, nutrient exchange, and healing in the disc tissue. The treatment is gentle, safe, and patients also describe it as relaxing, sometimes even falling asleep during the session. What makes it Back on Track unique compared to traditional traction is the controlled computer-guided movement. It doesn't just pull, it alternates in a way that mimics natural motion, which reduces muscle guarding and allows deeper decompression. Also unique is that this allows us to flex from side to side. Very helpful in areas where you've got a disc herniation pushing on the nerve going down one side of the leg. This works in concert with chiropractic biophysics treatment that we do to correct overall spinal alignment. Pain isn't always where the problem is. We see a lot of low back issues caused by forward head posture. We have to address both. How can your neck affect your low back? Well, see for yourself. Place your hands in the small of the back and then shift your neck forward. Feel those muscles tense in your low back? Yep, your entire body is connected, just like the song goes. So, who can benefit from decompression? We've seen great results for patients with herniated discs, bulging discs, degenerative disc disease, sciatica caused by disc compression, chronic lower back pain that hasn't responded to other treatments. Pregnant women, yep, you heard that right. The low back pain common in pregnancy does excellent with decompression. Of course, not everyone is a candidate. That's why we always start with a thorough exam and, if needed, imaging. Safety first, always. So a quick recap. A herniated disc happens when the inner material pushes out and irritates nearby spinal nerves. A degenerating disc can hurt too because nerve fibers grow in, making the disc itself sensitive. Symptoms often include back pain, radiating leg or arm pain, numbness, tingling, or weakness. These problems are sometimes misdiagnosed as hip, knee, or neuropathy issues. The decompression system helps in both cases by reducing pressure, restoring motion, and improving healing. Here's what I want you to remember. A herniated disc does not automatically mean surgery. With the right diagnosis and the right treatment, many people find relief, regain mobility, and get back to living their lives. If you've been struggling with back or leg pain, and especially if you've been told surgery is your only option, schedule an appointment with us. Let's find out if you're a candidate for non-surgical decompression. If you found this video helpful, hit the like button. Leave a comment if you've ever dealt with disc pain, and make sure to subscribe so you don't miss future videos. I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers. Thank you for watching, and remember, start taking steps today so you can take steps tomorrow.